Okay, good morning, everybody, or good afternoon, or good evening, depending on where you're calling in from. I wanted to welcome you to this webinar series that the Gender-Based Violence Community of Practice and the Women's Refugee Commission are hosting over the next 3 weeks. This is a great opportunity for us to really dive into the IASC guidelines on inclusion of persons with disabilities, and to really look at the links of how it works with gender-based violence. So for those of you who aren't familiar with the gender-based violence area of responsibility, that is the global working group, and we're happy to have a speaker from the Secretariat in Geneva with us today. And I run the Community of Practice. The Community of Practice is an online virtual community of over 800 GBV specialists from all over the world. And I recognize some of your names as being members on there: Mariana, Francesca, Rachel, Irene. So welcome to all the community members. If you're interested in joining the Community of Practice, all you need to do is to send us a message at gbvcop@gmail.com. So we're very lucky today that the Women's Refugee Commission and Emma Pierce, a specialist on GBV and disabilities, has developed and put together this webinar series for us to walk us through better ways that we as gender-based violence specialists can really work on inclusion and making sure persons with disabilities are well represented within our programming. This webinar also was supported by the Australian government, by DFAT, so we'd like to thank them for helping us with this, and also for making sure that we have closed captioning available for this webinar, which is an important step to make sure that everyone is able to participate, particularly living in this new world that we live in during COVID, where we all have to participate virtually rather than face-to-face, as we like to do. So just to remind you, if you're here on this webinar right now, that means you are signed up for the whole series. And so we'll be doing them over the next 3 Thursdays. This first webinar is an overview of the guidelines, just an introduction, and also to help you better understand how it fits in with some of the GBV guidance and documents that are already out there. And we're going to be hearing from 2 great speakers who are going to talk a lot more about the work that they've been doing in Zimbabwe and in Lebanon. One of our speakers will actually be joining us via video because the internet in Lebanon is not so great. The next week we'll be going a bit more in depth, and then the third week we'll be looking at how do you actually support and implement it. So please, we hope that you'll join all 3 webinars. And if we should not get to your questions in the first one, we'll be keeping track of everything through the chat box. We'll make sure that things that you've brought up are addressed in one of the other 2 webinars. So thanks again for, we want to make this as inclusive as possible. So just a little housekeeping before we move in. Things always can go wrong, so let's try to minimize them by making sure that your microphone is on mute. Just that helps reduce background noise and allow everyone to be able to hear, and it also reduces a lot of the bandwidth. Please write your questions in the chat box. As I mentioned, we'll be monitoring the chat box and we'll keep track of them. And if your question doesn't get answered, we'll try to make sure that the information you need is later received. Also, for the Community of Practice members, we share the recordings, and we can continue to chat. Emma is a member of the GBV Community of Practice. We can continue to chat about some of these issues on the COP as well. So we welcome you to join on there. I mentioned in the chat that closed captions are available for this webinar. So down at the bottom of your screen, you'll see a CC button. Please go ahead and click on that. This will help you make sure that you better understand some of the speakers that are coming on board and that you don't miss anything. And this is also a great tool that Zoom allows us to have, and it makes things a lot more inclusive for people to use. So I'd also really encourage you all, if you're hosting webinars in the future, to get closed captioning in there. And we have 2 moderators who are helping us with this right now. So thanks very much to them for supporting us. The webinar is being recorded right now, and it will be posted online the Gender-Based Violence AoR has a YouTube channel, which we'll upload the video to. You can also find it on the website of gbvaor.net, and then we will circulate the link through the community of practice. If you are registered for this webinar, you will probably also receive an email that has all the links to it. All of the tools, presentations, and the resources that we'll be talking about for the next 3 days will be found in this Dropbox link, which the community of practice maintains. This Dropbox is for all gray literature, things that are shared on the community of practice that aren't necessarily easy to find in other places. And this is a great resource that Emma has pulled together to help you with better integrating disabilities into your GBV work. Again, the link is there in the chat. And if you need access to it, again, you can always send us an email to either Emma or me. Okay. Without any further ado, let me turn it over to the fabulous Emma Pierce, who will be guiding us through the next sessions. Thank you.
Okay, thank you so much for that introduction, Sarah, and to all the speakers and participants who are joining us today. Just a bit of background, I'm actually working for the Women's Refugee Commission as a gender and inclusion consultant, leading a whole bunch of these webinars to support the rollout of the IASC Disability Guidelines among the gender and GBV communities with which we are a part of. I always learn something new at every webinar, so thank you to you all in advance for your contributions throughout the sessions. For those, I imagine most people are aware, but for those that aren't about the IASC, the Interagency Standing Committee is the primary mechanism for interagency coordination when it comes to humanitarian assistance. It is a global forum involving key UN, but also non-humanitarian partners, non-UN humanitarian partners. At the World Humanitarian Summit in 2016, there were over 150 stakeholders, including states, UN agencies, NGOs, and civil society organizations signed a charter, which was called the Charter on Inclusion of Persons with Disabilities in Humanitarian Action. And this charter basically called for us to develop endorse and implement global guidelines in relation to disability inclusion in humanitarian response. So that same year, the IASC actually endorsed the establishment of a task team, which was mandated to develop these guidelines. And so that was, I think, a 2-year process. The task team was originally co-chaired by UNICEF, Humanity and Inclusion, and International Disability Alliance. So it was a very interesting task team because it had 3 quite different types of organizations involved, including International Disability Alliance, which is actually an organization of persons with disabilities. And you're going to hear over the webinar series from more of our colleagues from the disability movement as we work through these 3 webinars. The guidelines themselves were developed through a consultation process, which included workshops at global and regional levels. Online surveys were conducted, and then there were sectoral working groups established that drafted specific chapters and got those validated within the sector working groups and communities of practice. So many of you probably contributed to that process, in particular the sections of the guidelines that relate to GBV, and we want to thank you for those contributions. They were very important. So the guidelines themselves were actually finalised and endorsed in October of last year, and the task team has now transitioned to a reference group, which serves as a platform for cooperation between UN agencies, NGOs and organisations of persons with disabilities. And that reference group is working not only to roll out the guidelines, but also looking at a range of other issues relating to disability inclusion in humanitarian response. If you are interested to join the reference group, I've put the website link there in the PowerPoint, and we can circulate more information, but please feel free to go and check out that website and join the reference group if you are interested. Something else I also wanted to share was these guidelines, the guidelines themselves, we have uploaded also to the Dropbox, even though they are available online. And also they are available in screen reader accessible formats. For those of you that requested screen reader accessible formats for different resources, we have included those where they are available onto the Dropbox. So it's a good sort of central portal for you to go to get that. Next slide. Thanks, Sarah. The guidelines start out with a definition of persons with disabilities, and this definition is very much in line with the Convention on the Rights of Persons with Disabilities, and you're going to hear more about this convention from our colleagues from the disability movement. Essentially, the IASC Disability Guidelines describe persons with disabilities as being those that have long-term sensory, physical, psychosocial, intellectual, or other impairments that in interaction with various barriers prevent them from participating in or having access to humanitarian programs, services, or protection. Next slide, thanks, Sarah. The IASC guidelines are really designed for mainstream humanitarian stakeholders who might play a role, including organisations of persons with disabilities who might play a role in mainstreaming disability in humanitarian programs. There are 4 objectives that the guidelines have. The first one is to provide practical guidance on how to include persons with disabilities in humanitarian programming and coordination. The second one is to increase the capacity among humanitarian stakeholders to develop and implement quality programs that are inclusive of persons with disabilities. The third objective is to describe the roles and responsibilities of humanitarian stakeholders when it comes to disability inclusion in these contexts. And then the last one, the fourth one, is to increase the participation of persons with disabilities and organisations of persons with disabilities in preparedness, response and recovery efforts. So the guidelines are not designed for organisations who are delivering specialised disability services or assistance, such as physiotherapy or rehabilitation. So that's not something we're going to be covering in this webinar series. Instead, we are going to look at how these guidelines can support inclusion and participation of persons with disabilities in your GBV programming. Next slide. Thanks, Sarah. Oh, I'm sorry, Sarah, you were a step ahead of me. Please go back one. Thank you. So just going over the structure of the guidelines now. The guidelines start with an overview of the legal frameworks and policies, as well as the principles of the CRPD, which we're going to learn about shortly from Rose, who will be speaking to us today. It also provides a summary of key definitions and concepts relating to disability inclusion. The second section in the guidelines is where we start to learn more about key approaches and must-do actions as they relate to all types of humanitarian programming. We'll talk more about what these must-do actions are in a moment. The third section provides more detailed guidance on how to apply these guidelines in different phases of humanitarian response, including assessment, analysis and planning, resource mobilisation, implementation, coordination, and monitoring and evaluation stages of humanitarian responses. The fourth section outlines the roles and responsibilities that governments, humanitarian leadership, cluster and sectoral leads, programmers, donors, and organisations of persons with disabilities should play in promoting disability inclusive humanitarian response. And then the last section, which is actually a substantial section, is where it breaks these guidelines down into sectors and subsectors. And here there is a protection chapter, which has recommended actions aligned to the program cycle. There are also recommended actions for subsectors, including the GBV subsector. And we're going to talk a lot more about that in next week's webinar. Next slide, thanks. Thanks, Sarah. As I said, there are some key approaches or must-do actions which are applied across all phases of humanitarian programming. And these are the 4 sort of overriding must-do actions or key approaches that the guidelines promote. The first one is to promote meaningful participation of persons with disabilities in our program decision-making. And linking to that, the second action is to empower persons with disabilities, to support them to develop their own capacities and be able to contribute to humanitarian response meaningfully. The third must-do action, and we will talk about this a little bit later on in today's webinar, is this idea of analysing and removing barriers that prevent people from accessing our programs or hinder them from being a part of our program. And then the fourth one is for us to really think about disaggregating data, both qualitative and quantitative data, for the purposes of monitoring inclusion. Next slide. Thanks, Sarah. As with all guidelines that we have in the humanitarian sector, there are also some cross-cutting considerations that have been included in the IASC Disability Guidelines. And those are pretty standard, pretty much in line with what we've seen in other guidelines and at the highest levels of our humanitarian practice. The first one being, you know, to profile age, gender, and diversity, and to think about that. Protection mainstreaming, in particular, prioritizing safety, dignity, and avoiding harm is considered a cross-cutting issue for these guidelines, and a lot has quite big implications for our GBV programming, of course. And then the last cross-cutting issue that the guidelines cover is mental health and psychosocial support, which, you know, again, I think it really intersects quite closely with the work that we do as GBV actors. On that note, I will stop there. I will be talking to you again later today, but I'll stop there and hand back to Sarah. Thank you, Sarah.
Thanks so much, Emma. Very interesting overview. And now I want to introduce Rose, who's calling into us from Zimbabwe. Rose, I am unmuting you now, and please feel free to introduce yourself, and I look forward to hearing your presentation.
Sorry, Rose, we can't hear you. You need to unmute.
Okay.
That's great. We can hear you now. Go ahead, Rose.
Go ahead, Rose. We can hear you great.
I think we might have lost Rose there, Sarah.
Hello.
Hello. Go ahead, Rose.
You can hear me now?
Yes, perfect.
Okay, thank you so much. I will start by introducing myself. And I was saying I'm Roswitha Mdarikwa, and I'm based in Zimbabwe, in the ancient city of Masvingo. And I represent the network of African women with disabilities. We are present in many African countries, and what the network of African women with disabilities has been doing, maybe let me start by giving you the background of the network of African women with disabilities. We established ourselves in 2005. That is a year after the Maputo Protocol for women, African women. And that was also after the Africa Decade for Persons with Disabilities. The main reason was that we had observed that there were yawning gaps, especially to do with inclusion and participation of women and girls with disabilities. So you will notice, even from the guiding principles of the UNCRPD, that our activities or our work is related to the guiding principles of the UNCRPD. the idea was to make sure that there is effective, full and effective participation and inclusion in society of women and girls with disabilities. So those yawning gaps were the ones we were targeting, and we were trying to see to it that women and girls with disabilities who were also not quite active even in organizations of persons with disabilities would also be included and would participate effectively even in gender-based violence. So you see, the idea is for inclusion. The idea is to ensure full participation of women, and for us to realize that inclusion and the full participation, we felt that we needed to organize ourselves. We needed to have that collective voice so that we could speak out maybe as women and girls with disabilities from Africa. So that's the network of women with disabilities. But then for us to be able to do that, we needed to do some capacity building. We also needed to do some training. And one of the pictures in one of the pictures that is
Rose is calling in from Zimbabwe, so there might be a few problems with the transmission. I'm not able to hear her right now.
And I want to thank them. We have been working with them so well, and it has been easy for us because they are quite flexible, and you don't need to fulfill so many things. So it has been quite a privilege to us to work with Women Refugee Commission, because they have made an effort to reach out to us, and this is now why we can participate. Earlier on, we even had our own webinars, 3 of them, to at least introduce us to the new normal, where we work through the virtual platforms. And this is why now we can also even participate in this webinar. So that's the network of African women with disabilities. We still have got challenges. You know, in Africa, the network is a challenge. Also, the ICT technologies is a challenge. The skills to be able to navigate the virtual platform is also a challenge. But we are happy that we can at least cope, and we can also participate. And we are looking forward to be addressing some of these challenges as we go along. So as a network, we are really trying very hard. And because of the earlier webinars that we had in July, we can also say that, things are changing, and we are starting to cope with the new normal, though we still have got some challenges. And then what I also want to talk about today is that these guiding principles of the UNCRPD, they are for persons with disabilities. And what I also want to emphasize is that they are also for women and girls with disabilities, because for us, women with disabilities, it is very important to us, for our inherent dignity and our individual autonomy to be respected. So these principles are also very important, and because we also feel that we also need to be able to make our own choices, and we also need that independence of persons. And non-discrimination is also quite pertinent to women and girls with disabilities, especially on the African continent. And we are very appreciative and grateful to the us and for including us, because that also enables us to be able to participate effectively and not to be discriminated. Also, what is important to us is respect for difference. You know, as women with disabilities, there are several disability categories. And for us, that diversity is very important to us. And earlier on, when Sarah was introducing this webinar, she spoke of closed captioning. I think those are efforts being made to ensure inclusivity of women and girls with disabilities, especially from Africa. Because with closed captioning, it means that that means access to us. That is accessibility. And to us, that is also recognition of the guiding principles of the UNCRPD. Then there is also the issue to do with the equality of opportunity, because once you get the opportunity, you are guaranteed of full participation. And I have spoken of accessibility. I have spoken of the equality between men and women. This is what is quite important to us as a network of African women with disabilities, because those yawning gaps that lead to our having to get together and mobilizing ourselves, it was because the equality between men and women with disabilities was lacking. So we felt if we could come together, then we could have that equality being realized. Then there is also the respect for the evolving capacities of children, because as women, we also feel that the children and the youth are sometimes left out. So that building of alliances between us as women and girls with disabilities and children and the youth is very, very important, since we also have got common issues, we have got common concerns, and our getting together strengthens us. It strengthens our advocacy voice. So as a network, I think the guiding principles, you can get them. They are on slides. I think there are about 8 of them, but I think what I have actually or what I have been highlighting, not because they are more important than others, but what I have been trying to highlight is inclusivity of women and girls with disabilities, the recognition of diversity, and also the full participation. And, you know, the full participation is what we are advocating for and what we are also promoting. Why are we promoting that? We are saying, as a network of women with disabilities, we are available to be consulted, so that whatever services you might want to deliver to African women with disabilities, it's delivered based on our demands. It's demand driven. And then the other issue is also to do with our full participation. And also we are saying we are available as advisors. We can always advise on how best you can deliver services to us, because we also experience gender-based violence. And sometimes it's so difficult to speak out on gender-based violence. Why? Because sometimes, you know, some of the caregivers are also responsible, or should I say they are perpetrators. So it's difficult for us as women and girls with disabilities to speak about the gender-based violence. But if we are participating, you know, in the in webinars like this, then we can also work out ways and approaches of how best we can speak out about our gender-based violence experiences, and how best we can be assisted, how best we can get services, so that at least we can also be able to participate and be able to minimize, the gender-based violence that is experienced by our members. So definitely I have heard about the websites and how we can also join the community of practice, and how we can also join the gender-based violence for our network. That is very important, because that will empower us and will give us a platform where we can share our experiences and where we can say how best can we also address, the gender-based violence that is being experienced by our members. So let me once again say that we are very grateful to be participating on this webinar, and to us, that is leading to the realization of our full and effective participation and inclusion in society, and also the respect for the difference will also assist us in being able to working with all those who are giving the services and who also want to be able to reach out to women and girls. As a network, we also do coordination, and we also assist with linking service providers with our members who might need your services. So the other slide has got my email. If you want to reach to us, or if you are working in a certain African country and you don't know who to approach or who to work with, especially with the women and girls with disabilities, we are always available to link you up with our members in most African countries, because we are present in most of these African countries. And where we are not present, we have got a way of linking with organizations of persons with disabilities. So I think for today, that is what I will say. And thank you for listening to me.
Thank you so much, Rose. That was really fascinating. We will send Rose's email address to everyone with the notes if you do want to get in touch with them and work with them and their great network that they have. Next, I'll ask Emma to come back and tell us a little bit more about analyzing and removing barriers from programming.
Thanks, Sarah, and thank you, Rose, for that presentation and for covering all those principles. As Rose was talking about the principles of the CRPD, the thing that came to mind for me was that these principles are very, very similar to the principles that we have when we're implementing a survivor-centered approach in our GBV programming. So it's important to not see these principles as separate and different. They are actually very closely aligned and can support us in the work we're already doing. I'm going to talk a little bit now about analysing and removing barriers, which is one of the approaches that the IASC Guidelines encourages us to do across all programs, but also over activities. So you can actually do this task for specific GBV activities that you are running. Next slide. Thank you, Sarah. And the way we like to describe this process is first of all to understand that barriers are factors that hinder participation and actually contribute to the experience of disability. Where barriers lead to exclusion, persons with disabilities may face added vulnerabilities and threats compared with others in the affected population. On the flip side, however, we have what we call enablers, and these are measures that we can put in place to help remove these barriers, to reduce the effects of these barriers. And when we put in place an enabler or try to create an enabling environment, this in fact improves the resilience and protection of persons with disabilities in humanitarian crises. Next slide, thanks, Sarah. So I just wanted to give you some examples of the different types of barriers and enablers that might affect GBV programming and activities. Now, these are just examples. They're not designed to be a comprehensive list. And you know, if you have a look through some of the resources that we have on the Dropbox, you'll find a lot more information about different types of barriers that persons with disabilities face when accessing GBV programs and activities. we like to think about barriers in sort of categories. And so there are 3 categories that I wanted to highlight to you today. The first one is what we call attitudinal barriers. And these are really significant barriers. A lot of the time when we talk to women and girls with disabilities in humanitarian contexts, they say that they perhaps haven't even been invited to some programs and activities. And oftentimes when we track back why that is, it relates to attitudinal barriers. So, for example, some staff might have assumptions that persons with disabilities cannot make their own decisions, or perhaps participate in a way that they feel is appropriate in a GBV program or activity. So the way we can unpack that, and the way we can turn, create more of an enabling environment is to support staff to have a better understanding of the rights of persons with disabilities, and that they have a right to take decisions on issues that affect them. And this includes people with intellectual and psychosocial disabilities who can make their own decisions if we give them support and communicate information in a simple format or in a way that they can understand. The second type of barrier that is that most of you will be probably more familiar with is what we call environmental barriers. And this, for example, could be stairs outside of our women's centres, or a lack of transportation to reach facilities. The barrier that I wanted to highlight here today is about information and how we provide information on our GBV programs. Sometimes in some refugee contexts, we do that through community leaders, and they're our main portal for getting information out to the community. But maybe those community leaders are not regularly in contact with people with disabilities, particularly in contexts where having a disability might result in where there might be stigmatization in the community when someone has a disability. So it's really important that we don't just rely on one method of communication or sharing of information. So we should be sharing information in multiple formats, which can be through community leaders, but also perhaps through easy to read and picture-based formats. If you're interested, we have provided some examples of these easy to read and picture-based formats in the Dropbox for you to have a look at. And then the third type of barrier is what we call institutional barriers. And these are sort of a bit more structural. They're about how we operate as a humanitarian sector. So an example here might be that when we're doing a community-based GBV assessment, maybe we don't actually disaggregate any information by disability. Maybe we don't ask any questions specifically about persons with disabilities and the risks that they might face. And that results in us just not having enough information or not being aware of what their needs are. So the way we can change that, the enabler that we can put in place is actually adapting our assessment tools, actually including some criteria about having 1 to 2, women with disabilities in every discussion that we have with women, or looking at how we monitor who's attending a program. Oftentimes we'll monitor how many men attend and how many women attend. Maybe we can also look at how many people with disabilities, men and women with disabilities, attend an activity. And that will help us to know what we need to, who we need to reach out to, and perhaps even ask for more advice from, as Rose said, about what the barriers are and how to adapt them. So please remember, you don't have to do this on your own. You can do this analysis with people with disabilities, community members with disabilities, and with organisations such as Rose's organisation of persons with disabilities. Thanks, Sarah. I think that's all I was going to cover on analysing and addressing barriers. Thanks for the time.
Thanks very much, Emma. Again, I just want to remind everyone on the webinar that you can use the closed captioning button at the bottom, the CC button, because we've had some people join a little bit later. And that will help you to understand all of the speakers. So next up, we have an amazing speaker, Mia Farrow, who is a self-advocate with the Lebanese Association for Self-Advocacy. Now, because of the terrible situation in Beirut with the explosion, the internet there has been quite tricky. So in order to have her join us, she has sent us a series of videos. So she's going to join us via video, and there's a couple of short ones, so we'll be scrolling through them. So, all right, let's see if this works.
Hi, my name is Mia Farah. I am from Lebanon. I have an intellectual disability. In Lebanon, I am a member of an association called Lebanese Association for South Advocacy, LASA. LASA is member of Inclusion 2000. LASA, the first organization created by and for South Africans in Lebanon, an Arab country. With my friends, we started by talking about our rights. We also asking our support to tell us about the Convention on the Rights of Persons of Disability, CRPD. We have training about our rights and how to fight for our rights. Hi, my name is the presence of Syrian and Iraqi refugees in Lebanon has slowed us a new aspect of discrimination. The refugees were alone because they are refugees, because they have an intellectual disability, and above all for same because they are girls. We decide to work together. We wanted to show them that they are not alone, to give them a little help. The rest was very good. The young people and the parents insisted on having more meetings. Because of the virus, I am locked at home. I can no longer see my friends, who I miss so much. I am scared to leave the house because I don't trust anyone anymore. But my parents explained that institution to me because I stay does not take care of us at all. But I am still very scared. I have never felt anything like this in my life. It's already new and scary. But I have something that I love, and that calms me down a lot. I love to paint. Whenever I feel I am scared, I start to paint. The explosion of orchestra force increase my fears but very quickly the help of other the young people pushed me to do something with the help of my family. I work with a group of young people who send food to people who have a lot everything. I also call my friends to hear from them and make a plan to help people with disability who have been affected by the blast. My message is to all of you, the coronavirus will disappear one day, and we must be ready and strong. Let's prepare for after the coronavirus. We must build a better future. We are more aware, and we have to make good choice to create a better world for all. And then we will be free like a bird. Thank you. And thank you.
I wish that she was here, Mia was here with us to tell her thank you for that inspirational message. Definitely resonates with me, and I love her optimism. Now I'd like to turn this over to Stephanie Rule from the GBV AoR coordination team in Geneva.
Thank you, Sarah. Hi, everybody. My name is Stephanie Rule. I'm working as GBV and Emergencies Analyst with the GBV AoR. And we're based in Geneva. So thanks to everyone for joining us today, and also very much thank you, Sarah, for organizing it, Emma. It's really great to be part of this presentation today. And what I'd like to do is to briefly talk to you about how the IASC Disability Guidance intersects with the key guidance, key guidelines, key resources that we have in GBV that is core to our work. So I want to start, first of all, Sarah, if you can go to the next slide, thank you, to reflect a little bit on the specific vulnerabilities and also the increased risks that persons with disabilities face related to gender-based violence. Because I think that's really important to keep in mind. Persons with disabilities experience GBV really at a disproportionately higher rate, which is partially a result of facing several intersecting risk factors such as socioeconomic stress, gender inequality, age, and disability. But persons with disabilities are also facing additional vulnerabilities to GBV as a result of their disability. And in her presentation, Rose pointed out earlier that can be sexual violence committed by caregivers. Yeah, so as a result, they are 3 times more likely to experience physical, sexual, and emotional violence. And that is particularly dire for women with disabilities, which are up to 10 times more likely to experience sexual violence. Now, given the increased vulnerability and unique risks that persons with disabilities face, it's really essential that we integrate disability considerations across the GBV response and also across coordination. Yes, Sarah, you can go to the next, thanks. So what I want to highlight is that this isn't per se a new approach, and the beauty of the IASC Disability Guidelines is that they are bringing together in one place what has also been tried to be integrated in the various GBV guidebooks. So I specifically want to talk to you about the 3 core resources, which most of you are probably already very familiar with. Which is, first of all, the GBV guidelines for all sectors, which it targets humanitarians across all sectors and provides guidance on GBV integration. And secondly, we have the GBV IE Coordination Handbook, which we've just recently revised. Actually, it's been 2 years by now, but it seems very recent. And that's targeting GBV coordinators and also members of GBV working groups at different forms and shapes at the country level. And then thirdly, we have the GBV minimum standards, the interagency minimum standards that have been released last year, which are for GBV program officers. Now, if we go to the next slide, we can start with the GBV guidelines, because it's actually the structure and purpose of both the IASC Disability Guidelines and also the GBV guidelines is quite similar. So the idea of both is to provide practical and easy to use suggestions on how to integrate considerations related to GBV and related to disability inclusion into the work of the various sectors. Both that guidance documents provide recommended actions that are related to the various areas that you can see on the slide, to assessment, analysis and planning, to monitoring and evaluation, and also to project implementation. Now, I think importantly, the GBV guidelines already advocated for all GBV related indicators across sectors to be disaggregated by sex, age, disability, and other vulnerability factors, which is also a key point that's reflected in the guidelines for disability inclusion. And what we've heard about in the previous presentation can really help us evaluate, understand, and respond to the specific barriers and understand the particular situation that persons with disabilities face. Now, if we go to the next slide, we can see that the guidelines for inclusion asks or recommends to train local organizations of persons with disabilities in how to safely refer GBV survivors. And here we can draw on the GBV Pocket Guide, which is actually really excellent in having disability considerations integrated throughout. It calls on practitioners to include disability service organizations in the service mapping, to be aware and mindful of the specific barriers that persons with disabilities are facing to access services, as well as also safeguards in terms of communication to persons with disabilities, confidentiality, in confidentiality rather than in the presence of their caretakers, and several more. So that's another great guidance that we can draw on. If we go to the next slide, I believe we're in, so here we have the interagency minimum standards. So if we're looking for further guidance really related to all of the different areas of GBV response, we can look at the minimum standards. And here the IASC Disability Guidelines integrates a call for responsible, compassionate and confidential care to GBV survivors with disabilities. And if we look at the very beginning of the minimum standards, what's really highlighted is the survivor-centered approach, which is founded on the guiding principle of non-discrimination, that survivors should receive equal and fair treatment regardless of their age, disability, gender identity, or any other characteristics. So in practice, that means that we are from the start committed to applying an intersectional approach to GBV programming that is inclusive across all areas. So it's integrated as the precondition for programming across all of the GBV program areas. And we need to make sure that we find inclusive approaches across all of the standards. Now on this slide, we highlighted healthcare, psychosocial support, case management. But it really needs to be integrated across all 16 standards. Right, maybe I can highlight a few of them. If you're including services for persons with disabilities in referral systems, that's integrated in Standard 7. Standard 8, ensuring accessibility of women's and girls' safe spaces for persons with disabilities. What we've already mentioned is, again, in Standard 14 on collecting data, that it needs to be disaggregated. And then we have a standard on coordination, which also calls for integrating considerations related to disability inclusion in the coordination, Standard 15. And since I'm coming from the GBV AoR, I want to take a bit of a closer look at this last standard, coordination, and we can move to the next slide on the GBV Coordination Handbook. Thank you. Now, the GBV Coordination Handbook provides guidance on the core coordination functions. I mean, it's structured in 3 parts, and there's also there's an explanation of the humanitarian architecture and where GBV sits, roles and responsibilities, which also calls on all actors to integrate disability inclusion across the response. And it has a last part which goes on soft skills and how to coordinate. But what's really core guidance is the second part, which looks at the core coordination functions. And here, Sarah, if you can move to the next slide, I just want to highlight a few entry points for how disability integration needs to be addressed across the core functions. So if you start with response planning, you have assessment, analysis, and planning up high. And there, I think we've already talked a bit about how the analysis of GBV risks and barriers needs to be planned for and integrated in the assessments and also in the response plans. Then the core function of facilitating service delivery needs to take account of mapping and including disability inclusive services into the GBV referral pathway. It can be a good practice to have a standing agenda item on updates related to making services inclusive, making planning inclusive in coordination meetings. In terms of the implementation, again, it goes back to accessible programming and how to ensure that services are accessible. But to make that a reality, we also have to look at the resource mobilization and an inclusion of organizations for persons with disabilities in donor events, funding appeals, and also to try to find direct funding opportunities to women-led organizations for persons with disabilities. One last point that's highlighted on the slide as well is the monitoring and evaluation, the importance of finding disability strategic response indicators that can help us really monitor and evaluate how inclusive is our response, how do we address barriers, and then adjust programming accordingly. And another point worth mentioning also that it's important to have disability inclusive feedback and complaints mechanisms to make sure that people can provide their feedback and be part of the discussion. So I want to stop here to leave some more time for Q&A and hopefully a vivid discussion. But maybe just as one key point of takeaway, the IASC Disability Guidance is really closely aligned with our core GBV guidance and can support us in the work. So it's not an additional thing we do, but it can really help us do what we're already committed to doing in a better and more inclusive way. Yeah, so thank you very much, and back over to you, Sarah.
All right, thank you so much, Stephanie. Good to hear. You know, it's really important that we make sure that we are reflecting on this in our coordination structures. And I was glad to see all of the different ways that it interacts with the GBV existing materials. And you can find all of those GBV materials on the GBV AoR website as well. So now is the time for your questions. I think the first question we'll ask Rose if she can respond to it. So Rose, if you can unmute yourself. And this question is from Rachel Ado-Jiu in South Sudan. She said, thank you very much for this opportunity. I would like to request if I'm connected to an organization that supports persons living with disabilities, because in South Sudan, they are not being focused on as a priority and their vulnerabilities are beyond description. So Rose, maybe you could respond to her and tell her a bit more about how she can get connected. Rose, I will unmute you so you can respond.
Hello.
Yes, go ahead.
Okay. The question was from Rachel in South Sudan. And I think the challenge is that she is not connected to any organization or any group of women and girls with disabilities. But maybe I think I've got good news for Rachel, because we have got an organization in South Sudan, and I think I would encourage Rachel to send me an email so that I can link her to the organizations in South Sudan. And then we also even have certain individuals in South Sudan who are also not linked to any organization. So I think I would love to have a discussion with Rachel so that I would get to know what exactly she needs, and then be able to give her the assistance that she actually needs, because we even have got even other service providers in South Sudan who participated in our webinars in July, whom I think would be of great assistance to Rachel. And then I think even us as a network, we are prepared to work with Rachel and be able to assist her till maybe she gets what she wants. So I think once again, there is a slide with my email, and I would greatly appreciate if Rachel could inbox to me so that we could talk further and be able to assist her in a way that will suit maybe her needs.
Thank you so much, Rose. And this is one of the reasons, I just want to make a plug for our gender-based violence community of practice. This is one of the reasons we started a community of practice, because we want to bring together people who wouldn't maybe necessarily meet in person in a virtual platform to share with each other. So Rose in Zimbabwe helping Rachel in South Sudan, and maybe connecting with Pamela in Jordan and different people around the world. This is a place where we can learn from each other and really support each other in a lot of the very common things that we all face together, the struggles that we face together. So if you want to join the community of practice, it's at gbvcop@gmail.com. Our next question comes from Mariana Santoyo, and she says, at the Caribbean, we are trying to include disabilities in our programming. And just yesterday, we were discussing how to set targets for people living with disabilities. I understand the estimate is around 15% of the population are seen as living with disabilities. Is this a good estimate? And how do you recommend to start engaging with people living with disabilities when they have not been identified or part of our programming yet? Emma, would you be willing to respond to this for us?
Sure. And before I start sharing my perspectives on this, I should just emphasize that there might be other participants in the meeting today that can also share their experiences in relation to this. So that 15% figure is a global estimate that is drawn from the World Report on Disability conducted in 2011. So yes, it's a good estimate when you don't have detailed information about the number of people with disabilities in a given population. You can assume that about 15% of the population will have some form of disability. And therefore, if we're having a representative if we're reaching a representative sample of the population, 15% of our participants in any activity should have a disability. So it's a good place to start that figure, and just to start recording how many people with disabilities were involved in our women's in our women's economic empowerment program. If there's none, then perhaps we need to do some more targeted awareness raising to reach those women. And that comes to the second part of your question, Mariana. So in our work with, in the work that we've done at the Women's Refugee Commission, We actually find one of the most effective ways to reach and learn more about people with disabilities and women and girls with disabilities is to go into communities and to raise awareness about disability, to explain to people, community members, that we want to learn more about the needs and the barriers that persons with disabilities are facing, and we actively invite women and girls with disabilities to join group discussions that relate to a whole range of different topics that we might be exploring in a given context. And we find that that step alone, just being quite purposeful in our messages and inviting them, actually results in a lot of people with disabilities coming forward and asking to participate and asking to be a part of whatever activity it is we're running. I think one of the things that we probably don't realize is how much our messaging sometimes fails to reflect diversity. And because of that, sometimes people with disabilities don't think that a particular activity, such as an adolescent girls program, is for them. They think it's for other girls. And so being quite explicit and purposefully inviting people can help to address a lot of those barriers, and also help us to identify people with disabilities in the community. So that's how we approach it. I know that there are other organisations on the call today that have experiences in running surveys, house-to-house surveys, where you collect information and have structured questions that you collect from each household to help identify persons with disabilities. I think a lot of the community work that we do relating to GBV prevention and, you know, risk mitigation, we can reach and identify people with disabilities just by talking about them more, by having more messages about this group when we're in communities and working with communities. I'll stop there, Sarah, and see if anyone else wants to contribute to that question.
Yeah, we had a couple of good questions and comments that came up. Florence Aliba mentioned in the last webinar the use of the Washington short set of questions for identification of people with disabilities was mentioned. She'd like to know how this can be used in integrating disability inclusion in GBV programming. And then I have two other questions as well. And Stephanie has also given a link to the AoR website.
So Sarah, if you like, I can just respond a little bit about the Washington Group short set. So yeah, that is a set of questions that was designed primarily and originally to be integrated into censuses, you know, the census that goes around house to house and collects information about a household and collates that into population, national level population data. So it's a really useful tool. It helps. The Washington short set of questions is, I think, 6 questions. Forgive me if I'm getting this wrong, 6 questions. And essentially it helps, the questions ask things such as, instead of asking, do you have a disability? They ask questions like, do you have difficulty seeing even when wearing your glasses? Which helps us to identify people that actually have impairments in their functioning, and therefore identify people with disabilities in a more standardized way. There are some examples of these questions being integrated into household surveys that are conducted in humanitarian settings. I would just stress that it's really important to decide what the purpose is of integrating those questions into a survey. Is it to help identify people with disabilities because you're going to plan a program for them? And to make sure that those questions are appropriate for the type of survey you're running. So if you're trying to do a rapid you know, questionnaire, looking at, you know, for example, looking at who needs, you know, access to food distributions or non-food items, you know, that might be more of a rapid response type questionnaire. For us in the GBV sector, though, we don't do a lot of household collection of data like that. A lot of what we do is consulting with communities, engaging communities. So here I would encourage you to think about, when you're running those community group discussions, you know, with women and men, boys and girls, you know, making sure that there's 1 to 2 people with disabilities in each of those groups, because that helps you to get a lot of very valuable qualitative information as well that you can feed straight into GBV programming.
Yeah, and Emma, that I think addresses some of Oswald's comment and question. He said that we must mobilize funds to support organizations of people living with disabilities. It's impossible to ensure inclusion and participation without them. Networking is super important, and he thanks Rose for mentioning it several times. He also says Mia said that she feels good when she does the painting, maybe the drawings as well, and that meeting other people who are doing the same thing as her in her neighborhood is so important. He's wondering, and you address some aspects of this, is it acceptable to meet people with disabilities during household surveys? It might be difficult for GBV experts as they don't do case identification, but if they're local organizations working with people with disabilities, it could make the work much easier and give us a chance to have authentic and reliable information to guide the programs. I don't know if you want to add anything to that, Emma, you're on mute.
Sorry. Yeah, I think essentially what we need to separate out here is case management versus safe identification and referral processes. As we know, as GBV actors, these are we have quite comprehensive guidelines on how to approach these different things in a safe and effective way. I think organizations of persons with disabilities, but also disability service providers who are oftentimes in regular contact with people with disabilities can be great, I guess, vehicles for safe identification and referral. But we would approach these stakeholders in the exact same way as we approach other stakeholders for safe identification and referral, which is to make sure that they understand the principles of how to do that safely, making sure that they understand that it's about giving people information and so that they can seek assistance directly. And also where someone might be trying to seek assistance, but not, needing some support to be able to do that safely and effectively, what these actors could be doing to support that. So that's how I would approach it. And yes, for sure, I think organizations of people with disabilities and disability service providers have to be part of our stakeholder group that we engage in safe identification and referral kind of mechanisms.
We have a little bit of chat going on in the chat room, which is great. We encourage you to do so. And Fulvia, I haven't forgotten your question. We'll come to that about tools for translation. But Mariana mentions that she's had some ethical difficulties with the Washington group questions. And if there are no services available, how do we deal with this, ensuring we're not just asking questions, but also responding to needs? And Martina and Vivek have both mentioned about the use of women and girls safe spaces for reporting and case management and how to maybe do baseline assessments. I wonder if you have any thoughts about the Washington group questions and then also the women and girls safe spaces. Emma, if you can unmute.
Oh, sorry about that, Sarah. I was actually interacting with Mariana and about to send Mariana a message about making sure that we don't collect. Mariana's pointing out here that sometimes we go around and we collect information, through household surveys using the Washington group questions, when we don't actually have any services to provide to meet the needs of these groups. And that's why I said before earlier that I think it's really important to think through why you would be collecting that data and making sure that you have the resources to respond to the needs that you're identifying, because yeah, sometimes we can be just raising expectations, and it's very common, actually, to be honest. It's very common for me to go into communities where people with disabilities say, so many people have come and taken our names and we didn't get any services from that. So, it's definitely an issue that we need to be thinking about coordination wise. I'm sorry, Sarah, there was another couple of questions there that I missed because I was distracted. I was thinking about Mariana's one. My apologies.
No worries. We were talking about using women and girls safe spaces to be able to, WGSS, Washington Group Short Set, a new acronym for me. Martina was saying that's what she's speaking about. And then Vivek is saying it's important to know the beneficiaries and providing information to participants that all needs will not be met by one actor, but other actors should be able to help as well. There are lots of questions about that. But I also wanted to make sure that one of the questions that was asked earlier by Fulvia in Syria was about something I think that was very interesting for me as well, is how can we support more of these translations of reports and guidance in an easy to read version? The UNFPA in Syria is very willing to make their documents more inclusive, but they don't have any expertise available internally. And so they are also trying to produce things both in English and in Arabic. And I know that often when we're talking about translating, we're talking about from English to other languages or Spanish or French. But what I learned through organizing this webinar with Emma as well was about being able to use closed captioning, about screen readers, and about making things actually accessible to other people. So beyond translating to languages, how do we support this?
Sarah, I'm just wondering if maybe Rose wants to respond to the point about how can we produce more documents in easy to read formats, whether they're, whether they're a local, how do we understand what local resources are available and access those?
Yeah, Rose, feel free to unmute and respond. And Stephanie, if you have any comments as well, I don't mean to leave you out. And then Danielle Roth has mentioned that you guys can all contact her at danielleroth@rescue.org. And she has some good service providers for easy to read based in the UK. And we're using closed captioning from a service in Australia, and Emma could also share the information from them. I found it actually quite reasonably priced for being able to provide this service. Rose, you have any thoughts?
Yeah, I was talking about the issue to do. Can you hear me?
Yes, we can hear you great.
Yes, the issue to do with the documents, how best we can make sure that the information is accessible. I think what is important is, communicating with the targeted group or the targeted persons, and then they say how best they want the information. Some don't even want to have the information in written format. Some might want it recorded. Some might want it, I'm thinking of our deaf colleagues. They might also want it in another form. So I think what is best is to be in contact with the targeted persons or the targeted groups. Then you learn from them how best they want that information. What is not encouraged is for us to just decide for people that they might want it translated maybe into a certain language, when in actual fact, that is not the challenge. I think the best is to communicate with the targeted persons, learn from them how best they want the information, and then you work on accessing that information in a format that they will have requested. I think that is the best way, because most people might just want maybe to get the information maybe in a focused discussion group or so forth. So I think what is important is just communicating with the target people, learn from them how best they want it done, and then you try and do it in a way that they will have recommended. Otherwise, in most cases, we translate information and then that information will just gather dust in shelves.
Thanks so much, Rose. In the chat group here, we're learning that we always have new acronyms to learn in our field. The Washington Group of Short Set and the Women and Girl Safe Spaces. It does make me want to just ask, I do think that the Women and Girl Safe Spaces, which is one of our main programming tools to reach women in humanitarian emergencies, to make sure that they're always accessible to people, to women and girls living with disabilities, and that we do good outreach to make sure these girls and women feel welcome in our services, because that's there was a previous webinar that we did with Cassie, the Child and Adolescent Survivors Initiative, and they talked about, there was a quote from a young woman who said, I am a girl and I am a woman first and my disability is second. So making sure I feel welcome is really, really important. I don't see any new questions.
Could I
Yes.
just add on the easy to read versions? If you're interested, we have put some examples of easy to read versions that we've produced for colleagues in Lebanon on GBV and child protection. And I've put that in the Dropbox. So you might find, for those of you that are perhaps in the MENA region, that could be a tool that you could take away and perhaps adapt to your context. I often find it's just great to there's a lot of these tools are available online. They might be more tailored towards, say, your high income countries, but they can give you an idea of how to simplify messages and to develop up something that's going to resonate more in your own context. So please do go and have a look at those as examples.
Yes, and I'm putting the link to the Dropbox again in the chat, and we will also share it when we circulate the PowerPoint and the recording of this webinar. And Gertrude Desiree Etobe is she's a member of our community of practice, an active member, and I believe actually it was her request that actually got me started to thinking about this webinar and approaching Emma to develop it. And we really encourage any persons in the community of practice, if you see a gap or there's something that you need, to let us know, and we'll do the best we can to try to find the resources you need to do your work better. So, and she's pointing out that, yeah, there's some online trainings you can do one-on-one, but what she really likes is, and misses, is the face-to-face trainings where we can speak more to each other and learn from each other. So we'll try to do we'll try to respond to that and see what else we can do. Now we're about to finish. We've got about 5 minutes left. So if there's any more last burning questions or comments, please feel free to drop them in the chat box. Otherwise, we have a small poll that we would like to ask you to fill out to help us, both understand if our webinars are helping you out, help us prepare for the next one. And again, if there's anything outstanding you want us to address in the next 2 sessions, please feel free to drop it into the poll there. So go ahead and vote in the poll, and we'll wait for a few seconds. Maybe while we're working in the poll, Martina has asked if anyone has any good materials for community awareness on GBV and disability. And I can mention that that I feel like is a gap a bit in the GBV world. And we're starting to try to address that right now in the Dropbox, not the one that Emma is sharing with you, but you can access it through the same link. We've started to collect some IEC materials. Oswald, the regional emergency GBV specialist based in West Africa, shared some nice materials from there. And we're encouraging people to share with us their IEC materials so that we can, people can have access to them. We're storing them in the Dropbox for the time being. So please feel free to, share with us all you can. Okay. So we'll leave the poll open for a little bit. About 50% of you have voted, so please feel free to give us some info. And as we finish it up, I want to just take a moment to thank Emma so much for organizing this fantastic webinar series, both the Child and Adolescent Survivors Initiative one and this one, and to really thank the Women's Refugee Commission for supporting us for the closed captioning funding. To thank our closed captioners for translating everything we're saying into the bottom of the screen. And I really want to thank Rose for coming in from Zimbabwe and giving such great feedback, and your network is quite inspiring. And Mia, if she gets a chance to listen to this webinar, to thank her as well for her inspiring videos. In the chat box, you can find her email addresses, and we'll circulate all of this as well. And we encourage you to reach out to each other, to share your information. The only way we can learn is if we all open up what we're learning and doing together and make sure that everyone has access to the tools they need. That means people living with disabilities, as well as GBV experts and specialists all over the world, from Myanmar to Jordan to the Congo to Colombia to Ukraine, to those of us slaving away in Europe and the US as well. And thank you very much again to the GBV AoR for making this possible too. A couple more minutes to fill out the poll. We're up to 70%. And we'll say thank you and goodbye to everyone.